Welcome back, dear uncles, aunts, brothers, sisters, and friends, to the Everyday Life channel, a place where we share knowledge about health, nutrition, and lifestyle in a friendly, easy to understand way, so that each day we can live more proactively, more peacefully, and more healthily through very ordinary habits. Ladies and gentlemen, there is a sad truth. Many stomach cancer patients only discover their disease when it has already reached an advanced stage, when treatment becomes difficult, costly, and the chances of survival are greatly reduced. What is even more heartbreaking is that the body had already sent out warning signals, but we casually ignored them, thinking they were just common digestive problems. Stomach cancer does not appear overnight. It develops silently over many years, hiding behind familiar daily meals, vague aches, and signs that are extremely easy to overlook. According to Globocan 2022, more than 1.12 million new cases of stomach cancer are diagnosed worldwide each year, with about 768,000 deaths. In Vietnam, stomach cancer is among the top 4 most common cancers, with a clear trend toward younger patients. Even more concerning, around 80% of patients in the early stage have no obvious symptoms, allowing the golden time for treatment to quietly slip away. Doctors warn. Right pointing finger emoji. Mealtimes are the golden moment to recognize the earliest distress signals from the stomach. If during your daily meals you experience any of the 4 abnormal signs below, do not hesitate. Go for a medical checkup immediately while there is still time. 1. Abdominal pain or discomfort in the upper stomach area as soon as you start eating. This is the earliest and most important warning sign, yet also the one most often ignored. When the stomach is healthy, food entering it gently stimulates digestive secretions. However, when the stomach lining is damaged or a tumor is present, even a small amount of food can cause pain, burning, or a heavy sensation in the upper abdomen right during the meal. Many people mistake this symptom for ordinary stomach pain, gastritis or stomach ulcers, eating irregularly or too quickly. However, the truly alarming point is for people with a history of chronic stomach pain. Right pointing finger emoji. If the familiar pain suddenly disappears, do not be complacent. In some cases, as a tumor grows and invades sensory nerves or causes silent bleeding, the pain sensation may actually decrease. This is not a sign of recovery, but could indicate that the disease has progressed to a more serious stage. 2. Feeling full after eating very little. Abnormal early satiety. You eat only a few spoonfuls of rice or a slice of bread, yet already feel bloated and unable to eat more. Early satiety occurs when a tumor occupies space in the stomach, reducing its ability to expand. Stomach motility is disrupted. Food remains in the stomach longer than normal. At this point, the stomach is like a bag that has been tightly squeezed, not yet full, but already feels cramped. The danger is that many people think eating less is healthier. It's because of old age and poor digestion. It's due to stress or fatigue. But if early satiety persists and is accompanied by unexplained weight loss, fatigue, or loss of appetite, this is a red flag that requires early endoscopic examination. 3. Nausea or vomiting while eating. Feeling nauseous when seeing food, smelling food, or halfway through a meal is not normal for a healthy digestive system. Apart from pregnancy or food poisoning, this symptom is often associated with digestive tract obstruction, pyloric stenosis, tumors disrupting stomach motility. It becomes especially dangerous when vomiting occurs repeatedly. Vomiting happens right at the dining table. Vomiting undigested food. Vomit contains dark fluid or blood. When a tumor is located near the pylorus, food cannot pass into the small intestine, leading to forceful vomiting. As a result, patients abandon meals, gradually become afraid of eating, and weaken rapidly. 4. Difficulty swallowing, persistent heartburn, and acid reflux. If you frequently experience a choking or stuck feeling when swallowing, the sensation that food is lodged in the throat, constant heartburn during meals, acid reflux that does not improve despite medication, you need to be especially cautious. This may indicate a tumor located in the cardia, the junction between the esophagus and the stomach. As the tumor grows, it compresses this area, causing food retention, gas buildup, and acid to reflux into the esophagus. Unlike ordinary reflux, symptoms do not improve with medication, they gradually worsen over time. They are accompanied by weight loss, fatigue, and loss of appetite. Doctors' advice to prevent stomach cancer. Stomach cancer is not a death sentence if detected early. The key lies in whether we listen to our bodies. Doctors recommend reducing salt intake, limiting pickled, smoked, and charred grilled foods, avoiding leftover food kept overnight, limiting alcohol and quitting smoking, increasing green vegetables and fiber-rich fruits, eating slowly, chewing thoroughly, and eating on time, maintaining physical activity to prevent abdominal fat accumulation. In addition to the 4 eating-related signs above, seek medical attention immediately if you experience black stools, prolonged loss of appetite, pale skin or anemia, rapid, unexplained weight loss, especially important. Right pointing finger emoji. Regular stomach endoscopy can increase the 5-year survival rate to up to 80% if cancer is detected early. People over 40, those infected with H. pylori, and those with a history of gastritis or stomach ulcers should undergo screening at least once a year. Ladies and gentlemen, our bodies are constantly sending silent distress signals. By listening a little earlier and acting a little more proactively, you can preserve many more precious years of good health, for yourself and for your family. Thank you for taking the time to watch the Everyday Life channel. If you find this video helpful, please share it with your loved ones, because sometimes a single click can save a life. See you again in our next videos, where we continue to walk together on the journey toward healthy living through the simplest, most everyday things.